Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, a podcast about a healing city. Recently, the Robert Wood Johnson Foundation gave its Culture of Health Prize to Baltimore for its work to counter the impact of trauma. Zeke Cohen, a member of the Baltimore City Council, and Reverend Kim Legree, the executive director of Healing City Baltimore, are leaders of this work. They speak to Dr. Josh Sharfstein about how this movement started, how it's changing practices across the city, and where it's headed. Let's listen.
Councilman Zeke Cohen, Reverend Kim Legree, thank you so much for joining me on Public Health on Call to talk about Healing City Baltimore, which just won the Culture of Health Prize from the Robert Wood Johnson Foundation. So I want to start with you, Councilman Cohen. First, tell me about the Culture of Health Prize, and then we'll turn to Healing City Baltimore.
Dr. Josh, it's an honor to be back with you. The Robert Wood Johnson Culture of Health Prize recognizes innovation in the public health space, and we were proud that Baltimore was named one of this year's winners. I think 240 cities applied, and due to the work we've been doing around trauma, we won.
So tell me about that work. How did it begin?
Yeah, so you'll remember that back in 2019, in the city of Baltimore, there was a school shooting in West Baltimore. And, you know, Josh, we, as you know, experience a lot of violence in our city. But to have it happen in a school in broad daylight, to have a beloved school member get shot, this was just beyond the pale. And so we held a hearing in the Education and Youth Committee, which I chaired at the time in the city council. And the name of the hearing was Youth Voices, Youth Violence. And we really wanted to hear from young people about what they felt we could do to keep them safe. And as opposed to hearing about the hardening the buildings or adding more metal detectors or anything like that, the young people were really clear that they wanted us to focus on reducing the amount of trauma that they were exposed to. They talked about their own experiences with gun violence, with food insecurity, with housing instability, and they turned to us, their city council, and said, look, that's what you all need to be focused on. For me as a former teacher, that was a really inspiring message to hear.
Reverend Legree, do you remember your experience at that moment, what you were doing and how these issues were coming to you?
Absolutely. Well, interesting enough, Josh, I was at the Baltimore City Health Department at that time as the assistant director for the Office of Youth and Trauma Services. And, you know, connecting with Councilman Cohen and the youth to really launch the training for our city's agencies was an absolutely amazing experience. I am from Baltimore. I lost my own brother in 2015 to gun violence. So I know firsthand what they meant by we need help, we need support. And working with Councilman Cohen and now supporting Healing City as executive director, we get to do just that.
So you mentioned training as one component of this response. You hear from these young people about the trauma that they have in their lives, and you're thinking, what can we do? So Councilman Cohen, tell me about this component of the response, the training.
Yeah, so just to sort of complete that story, I spent about a year with those young people just doing a listening tour across Baltimore. And I'm really proud to say that a year later, we actually went back to their high school, to Frederick Douglass, and Mayor Jack Young, who was our mayor at the time, signed the Elijah Cummings Healing City Act, which made Baltimore the first city in America to have legislated trauma-informed care. And part of what that bill did is it called for all of our city agencies to be trained in trauma-informed care. What does that mean? That means that every agency in Baltimore, whether you're the rec and park department, whether you're the libraries, whether you're the firefighter, you should understand the science, the symptomology, and what trauma does to the physical body and to the brain so that you can help our young people and our families be able to heal.
What does this training look like? Could you give me an example? Like if I'm a rec and parks worker, what shouldn't I be doing and what should I be doing?
Well, the great thing about this training is we have many great supporters and partners. So the training is really manned and managed by the Baltimore City Health Department with the support of Sage Wellness, a wonderful community Baltimore-based trauma-informed practice. They really work with city agencies to overhaul the complete organization, all staff, from top leadership to middle management to those that are on the ground on the front lines. And they go through training, even with learning Baltimore's history with racism and structural racism. They even learn trauma-informed care 101. They learn youth engagement. It's such a wide range of training that really supports a comprehensive understanding, not just of trauma, but culturally relevant practices that really address longstanding disparities in our city.
I'm a former teacher, and I really wish that as an educator, I had known about trauma, about its impact, and about how it can literally take years off of the lives of folks who've been exposed to it, just like any other disease. And sometimes the way it manifests, the way it shows up is in self-harm, right? We see the more trauma you've had and the more exposure to potential suicidality. Sometimes it shows up in kids being really withdrawn, or sometimes it shows up in kids acting out and misbehaving. And so, for example, when I go into a rec center, I want to see the staff paying attention, listening, engaging with our young people. What we're really looking for is that our staff, no matter where they are, even if you're a firefighter or a police officer, that you are maintaining a level of calm and professionalism, and that you're working to relate to the young person, to the person who has come in, who is manifesting their trauma. Because the thing that we know about helping to heal trauma is that it happens through relationships, right? That's the key to this whole science, is we have to be able to relate better to the people that we serve.
You don't want, for example, if somebody is not participating in an activity, for an employee to go over and say, hey, what's wrong with you? It'd be more like, hey, what's going on? Or is there something I can do to be helpful so that you can participate?
That's exactly right. Or what we sometimes see, which is the employee themselves may have experienced trauma, and so they can become triggered by seeing the young person withdrawn or acting out, and can themselves get into what we call hyperarousal or fight or flight mode. And you'll see either a teacher or a staff member start yelling, start panicking. That is what we do not want to see. What we want to see is a calm, serene setting where we're really working on building relationships with each other. And that's why, again, we've been teaching our staff to do mindfulness, which is a evidence-based set of practices that helps you to clear your mind, to calm, to breathe, and just to be able to better relate to the population that we are supporting.
Reverend Legree, would you say that this is about creating spaces where people feel like they belong, where young people can go and feel comfortable, and even staff people can go and feel comfortable, rather than having city spaces be spaces of conflict?
Absolutely. It's important that we understand that at the end of the day, even without all of the public health jargon, that we're really just simply talking about compassion, right? How are we providing safe spaces for our youth, families, and communities, no matter where they traverse, in Baltimore or any other city? At the heart of this is really adjusting to creatively support, like Zeke said, staff that experience their own trauma, but also readjusting our lens and our perspective so that we can meet everyone where they are with culturally relevant approaches and strategies to support our collective healing and growth.
So I am totally following the kind of training you're talking about. And I want to ask about other components to Healing City, Baltimore.
Yeah, absolutely. So one of the other pieces of our legislation is that after staff goes through training, we actually do a policy review and we think about the ways in which we, city government, each agency may inadvertently, unintentionally be inflicting trauma onto those that we serve. And we think about, are there tweaks and changes that are needed in order to really become a healing, trauma-informed agency? And so I'll give you an example, Josh. Our library system, right? Enoch Pratt, Baltimore has one of the finest library systems in the country. But after we went through this very extensive year-long training, one of the things that the head librarian, Heidi Daniel, said is, look, we have this zero tolerance policy that I'm very uncomfortable with. You know, this is a vestige of the war on drugs. We developed this policy at a time where we really didn't understand that addiction is a mental health disorder and a public health challenge. And our policy is that anyone who comes into the library who's either drunk or high or may have used drugs in the last 24 hours, the protocol is to immediately write that person up and kick them out. Well, what does that do? That just puts them back on the street to go use and maybe die of an overdose. And so what Heidi said is, I want to get rid of that zero tolerance policy. But I know that if I just get rid of a policy, I'm going to have a rebellion on my hands. My staff's not going to be happy. The public's not going to be happy. So what could I bring in that would be trauma informed, that would actually help people to heal from this disease of addiction and wouldn't leave us in a situation where we've got people that are getting high in the library? And so we settled on bringing in peer navigators. Now, these are folks, Josh, who have themselves experienced addiction, who have been through it, but then have become state certified, are able to help people get into treatment, are able to help people find whatever resource they need. This is an evidence-based practice. We know that it has a high degree of success and efficacy. And so starting in Penn North, which, as you know, is the epicenter of the opioid crisis in our city, we brought in a peer navigator who could help people who are dealing with addiction to be able to get services. And guess what? That worked. Instead of folks ODing in and around the library, we saw this great improvement in the relationship between the staff and the community. And so Care First, the health insurance company, saw what we were doing. They gave us a big grant. We replicated it. We're now in 8 branches across the city. But it's this idea that instead of trying to incarcerate or kick people out of our public spaces, why don't we bring healing? Why don't we bring peer navigators in so that we can address the root cause, which often is that trauma?
That's a great story. And I appreciate that you both want trained staff, but you also want the trained staff to be able to offer something that's really meaningful for people. Reverend Legree, I appreciate the training. I very much appreciate the extra services, the peer navigators that are helping people in libraries across Baltimore. I also understand that there have been new investments in crisis response, mental health crisis response. And Reverend Legree, could you explain to me what a mental health crisis response is?
Absolutely. So mental health crisis response is when an individual loses their ability to cope. And that can be due to any circumstance, whether that's a one-off circumstance like a car accident or losing a loved one, or it could be over a period of time, like people that go and serve in war, or chronic abuse at home, where it turns into PTSD, post-traumatic stress disorder, things like that. So sometimes we witness those individuals that are in mental health crisis where they need support immediately. They may be experiencing suicide, ideation. They may just be significantly depressed. But once again, our options in cities like Baltimore is to either go to the ER, right, or another institution that really has coined crisis response and mental health, support by admitting someone for a period of time. What we have noticed and really heard from our young people is that the process is not really compassionate and trauma informed, and that it exacerbates often the trauma that they're experiencing.
So what you're saying is, instead of the usual response of someone having to go to the emergency room and, being in the middle of that kind of crazy environment, instead of that, you actually in Baltimore can call someone who might come out and do a crisis response where you are a trained person to help.
Absolutely. We are utilizing the strength of highly skilled people with lived experience. Also, those that may be a little more sensitive and a little more trained to support someone in crisis, where they're recognizing the signs and symptoms and immediately getting them to a safe space.
So Healing City Baltimore has been able to get more resources for this kind of crisis response where people call and have a expert, a mental health professional, a team come to help them. How did you get them more money?
Yes. Our policy subcommittee from the Trauma Informed Care Task Force really advocated and worked with our city council to hold a briefing that really demanded the additional money that would prevent Baltimore crisis response from closing. It was essential that we got them the funding, or else they were at risk for not being able to continue serving our communities. And once again, they are absolutely essential to ensuring that we continue building bridges and leveraging culturally relevant trauma treatment services.
Thank you. So, Councilman Cohen, Healing City Baltimore is a set of training. It is a set of programs. It's policy. Where do you think it goes from here?
Yeah, so we're really proud that in addition to legislation, in addition to changing the law, that we've just seen a really strong commitment by our communities to participate in this work. We have partnerships at some of our main medical institutions like Hopkins and University of Maryland and Mount Washington. We have folks in our business community. We have a lot of, oddly enough, barbers and beauticians that have been participating in this work and opening up their barber shops as healing spaces. We have, of course, city government. It really takes a village to transform the culture and the climate of our city.
What has been the reaction of your counterparts in other cities to the work that's happening in Baltimore?
Yeah, so look, I think, Josh, we are experiencing a collective mental health crisis. I have not been to a place yet that is not experiencing some form of mental health crisis. We've seen a rise in the rates of addiction, depression, suicidality, harm, violence. We just saw after the pandemic just a lot of disorder, especially in our cities, particularly, frankly, on the West Coast, but here on the East Coast as well, where I think local governments have really struggled to figure out what are we supposed to do when the people that we serve, the communities that we serve, are really struggling. And I think that Baltimore was on the forefront of innovation in saying, you know what? We need a policy response, we need a legislative response, and we need to be all in on addressing the mental health challenges that we're seeing. And so we've been really proud that other cities like Cincinnati have reached out, and we're actually working in partnership and coalition with them to do their own version of the Healing City Act so that they too can become a trauma-informed city. We have had outreach from everywhere from Savannah to San Jose to St. Louis to Cincinnati to Pittsburgh to Philadelphia. All across the country, folks are looking at Baltimore and saying, we also have to address this severe, profound mental health crisis that we're seeing. And I'm just proud to see our city elevated in that way, because too often when we make the national news, it's not for something good. But I think in this case, Baltimore is really leading the country when it comes to trauma and our response to it.
Well, Councilman Zeke Cohen, Reverend Kim Legree, thank you so much for telling us this story and for the incredible work that you all are deeply involved in with so many people in Baltimore.
No, Dr. Josh, such an honor to be with you and your listeners. Thank you for what you're doing.
Absolutely. Thank you so much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.